Although death is a real possibility for someone with ME, with a trip out of the house if they're severely affected, or other severe overexertion, most often death will not occur. A relapse is a certainty, however, if someone with severe ME is overexerted. The case could be made that this should be taken just as seriously as the possibility of death. The suffering caused by a relapse in severe ME patients can seem crueler than death. While it may seem unkind to compare the experience of severe ME to death, can you imagine what it's like to be so ill and disabled, to be in what feels like 10 out of 10 pain much of the time, and 10 out of 10 nausea and vertigo and many other things, and then to suddenly have your pain and suffering levels double just because of one day or 1 week's activity? Can you imagine what it's like to lose years of sacrifice and discipline and slow improvement, hard won through intensive rest, in just 1 day or 1 week, to have all your hard work suddenly count for absolutely nothing, to not only lose the small gains you made, but to end up even worse off than before you started? Can you imagine being so severely ill and disabled that you have to spend 22 hours a day or more in a completely silent, dark room, trying hard not to even think, let alone move, lest you become far more ill? Imagine that all you had to look forward to focus on and cling to in your worst moments to get you through them was watching an hour of TV, listening to some quiet music occasionally, or a half hour or 5 minutes talking to friends and family or to your own children, or using the computer lying down for a few minutes, or spending a few minutes outside in the garden, or playing with a beloved cat or dog. Can you imagine suddenly losing the ability to do any of those things anymore, and having no respite or distraction from the agony-filled, dark, quiet room at all? Can you imagine this situation lasting months or even years, never knowing if things will ever return, even to the level of illness that you had prior to this relapse? And the level of illness that you had prior to the relapse was already just unbearable. Myalgic encephalomyelitis can be more severe and disabling than just about any other disease there is. For those of us with severe ME, the price that we pay for activity is extreme and prolonged. Severe ME can truly be a living death. It is vitally important that ME patients are allowed to judge for themselves how much activity it is safe and wise for them to attempt. Patients are the best judges of their own limits, and patients' judgments must not be overruled. Patients should never be advised, encouraged, or forced to be more active than their severely damaged bodies can handle. These decisions cannot safely or ethically be made by any third party. If a patient that has ME says they cannot or should not do something, then family, friends, doctors, carers, and hospital staff must listen.